Hi there, Janine here. Today we're just going to do a very basic warm-up series. This is perfect for anyone that is suffering from slight back issues. You feel like you've got a really weak core. So this is going to help teach you how to engage your deep abdominals and how to breathe using the lateral breathing technique with Pilates. And just really get those deep abdominals starting to work. So we're going to start laying on our mat. You're going to put the heel of your hands on your hip bones, fingertips on your pubic bone. So you've got that flat triangle with your hands. We're going into that pelvic tilt, so the pubic bone is higher than the two hip bones. Then going in the other direction, now the pubic bone is lower than the two hip bones, and I've got an arch of my back. So if you've got any back issues, just proceed with caution. Obviously, it's a good idea to get clearance from your doctor. So we're going into those tilts. We're just loosening up that lower back. Sometimes it just gets very tight, and that can be half the problem. You want to try not to squeeze your bottom here. And in the beginning, you might just want to do little micro tilts just until you get your confidence in that movement. So my back is pressing into the mat as I tilt that pubic bone up, and then you're going in the other direction, creating that arch at the back. Now we're going to come somewhere in between those two positions. So the two hip bones and the pubic bone are sitting in that flat triangle. I've got the natural curve of the spine, so I can run my hand underneath. My fingers are making a diamond, or my thumbs and fingers. From here, this is what we call neutral pelvis. From here, we're going to take our hands around the rib cage. You're going to take a long, really deep breath in through the nose, and you're going to feel your ribs expand outwards. On the exhale, you're going to feel the ribs come in and down. So I'll do that seated for a minute, but you can stay on the mat or you can join me here. You're going to feel the ribs going outwards. And then exhale. So the ribs are going out and back. And then as you exhale, they're coming in and down. So when you're lying, the back of the ribs are going down into the mat. Now this is a little bit tricky to start with. So imagine there's a big red balloon on the inside of your rib cage. And as you take a breath in, your ribs are expanding. That big red balloon is inflating and it's pushing your ribs outwards. We want to try not to raise the chest and raise the belly when we're breathing. Just in Pilates, obviously. So sometimes it takes a little bit of practice. It is probably the hardest thing in the beginning. Long inhale and long exhale. So we're just focusing on the action of the ribs going out and in. You can practice this anywhere. So in bed, when you're doing the dishes, when you're watching TV. Inhale through the nose, exhale through the mouth. Try and get that action happening. Once you've understood that a little bit, we're going to think about filling from the bottom to the top. So there's a few different ways that we can work this. So think the first way is filling from the bottom to the top. So inhale. Filling from the bottom to the top. My belly's not rising, my chest's not rising. And then on the exhale, we're going to empty from the bottom to the top. Long inhale. Filling from the bottom to the top and long exhale. Filling from the bottom to the top. Keep practicing that. And then I just want you to bring awareness to yourself. As you breathe in and as you breathe out, where is your tongue resting in your mouth? Keep going with that. I'll do a couple seated so you can see. You see the ribs going out and then the ribs coming in. And you can see, I don't know, we'll see if we can do it standing. A slight drawing in of the abdominals as I breathe out. I don't know if you can see that with my shirt. So keep going with that for a moment, and I'm just going to continue speaking. So what we're trying to get to activate is your deep abdominals, your transverse abdominis muscles, which they're a muscle that wrap around. It's literally like a corset. They sit very deep behind your rectus abdominis, your six-pack abdominals, and also your obliques. So very deep. They wrap around and they attach onto the back of the ribs and the top of the hips with fascia, which is made out of collagen. To get those muscles, those deep abdominal muscles to activate, we want to have a slight contraction of the inner thigh muscles. Now, in turn, once those inner thighs, so I've just used a ball. You can use a cushion, a rolled up towel, whatever you've got at home that is something a little bit soft that you can squeeze. You just want that little connection of the inner thighs. And then to get the transverse abdominals to work, we need the co-contraction of the pelvic floor and your abdominals. So both working together. By squeezing something and activating those inner thigh muscles, that's going to help the pelvic floor to switch on. Now we also want the diaphragm, which is a dome-shaped muscle that flattens out as you breathe. So as your lungs inflate, it flattens out. So it's like a dome and then it flattens out. We need the full range of the diaphragm. So that's why we want to take really long, deep breaths. So when you're practice from inhale to 5, exhale to 5. So we'll do a couple here. Inhale through the nose, exhale through the mouth. So the reason why I mentioned the tongue before is where it rests in your mouth when you breathe in and when you breathe out, is because there's a connection between the tongue and the pelvic floor. So now just try putting your tongue on the roof of your mouth behind your teeth as you breathe in, and then as you breathe out through the mouth, the tongue stays on the teeth, behind the teeth, on the roof of the mouth. And you might find that connection deepens. So we've got inner thighs, co-contraction of pelvic floor, and abdominals. Diaphragm is fully flattening out or fully contracting, and then we also have muscles down the side of our spine called multifidus or multifidi. All of that together is your core. So just getting this breathing right is going to help really stabilize through your lumbar region. So from here, we're going to start to move the body now. So heels are going to be, or feet are flat on the mat. Your heels are lining up with your sit bones. You approximately, if you lift up, you can almost touch those feet. Hands are down by your sides. Arms are nice and active. Long, deep breath in through the nose. Make sure you're relaxed through the head, neck, and shoulders. And then on the exhale, you're going to use your abdominals to create the pelvic tilt. From here, rolling up, lifting those hips up. Inhale, pause. Exhale, you're going to come down, imprinting every single vertebra down into the mat. At the last little minute, releasing back to neutral. Breath in. Expand those ribs. On the exhale, use your abdominals to create the pelvic tilt, rolling up, lifting those hips up. Inhale, pause. Exhale, rolling down. Think about coming down. Every vertebra is imprinting into sand. Good. If this doesn't feel good for your back, if you're getting twinges and things, you can just gently do a slight little hip thrust, just until you start to build a little bit of strength. So we'll continue with the pelvic curls for 3 more. Breath in. Create the tilt. Knees are going away from you, so you've got a line from your pubic bone to your sternum. Breath in. Rolling down. Now, you may not be able to get as high. That's fine. You're just going to work to your body's ability, so don't push it in the beginning. In a few sessions, you will notice how much higher you will be able to get. 1 more here. Sending the knees away from you so you're not going into neck and shoulders. Feel the length in those hip flexors. And then rolling down upper back, middle back, keeping the pubic bone tilted towards you. And at the last little minute, you're going to release back to neutral. From here, we're going to take our arms to the ceiling, open out to a T. Try to keep the shoulders down away from the ears. Walk your feet closer to your bottom. This is a modified spine twist. Knees are going to stay nice and level. Now, in the beginning, you're just going to do a gentle little movement and coming back to center. Inhale, going over. So my heel is lifting, or heels are lifting off. My knees are staying nice and level. So inhale, filling from the bottom to the top. Exhale, coming back to center. As you get more confident, you can go that little bit further so that the hip is starting to lift off now. Knees are still level. So inhaling, you're going over. Exhale, drawing those abdominals in. That hip is lifting off, that heel is lifting off the mat, or the toes are lifting off on the top foot. So as I come over this top leg, the toes are lifting off the mat as well. Good. Now I mentioned there's a couple of other ways to breathe. So again, we're just going to focus on the expansion of the ribs, but if you find you're not getting that deep connection, filling from the bottom to the top and emptying from the bottom to the top, have a sense of drawing your belly away from your shirt. So long inhale. As you exhale, think about pulling your belly away from your t-shirt or your singlet. At the same time, you don't want to hold tension in your back. So if that goes straight there into those strong back muscles, because generally people overwork their backs and not their abdominals. If it goes straight there, just go back to the other breathing that we did. Gentle pulling away from your shirt with that belly button. Now if that still, you're not getting that connection, you can imagine a piece of string from one hip bone to the other. As you take a breath in, ribs are expanding, and as you exhale, you're thinking, drawing those lower abdominals away from that imaginary piece of string. So there's 3 different ways. Everyone kind of gets the connection, relates to them a little bit different. So see how you go. Long inhale, exhale. You just don't want to be gripping those back muscles. All right, and then the final movement we're going to do today is you're either going to take a small ball, or you're going to get like a tea towel or little face cloth or a hand towel or something, and you're just going to slide your heels along the mat. So I'm going to use a ball. but if you don't have a bowl, that's fine. You've got that neutral pelvis, so 2 hip bones and that pubic bone are in that flat triangle, so you can find your position by going in between, gentle rock of the pelvis. And then from here, take a breath in, ribs expand. Start your exhale, your tongue's behind the roof of your mouth. Engage those deep abdominals as you exhale and roll away. And then inhale, we're going to bring the ball back in. Exhale, set the core, so start the exhale. Those deep abdominals are engaging. Continue exhaling as you roll the ball away. Inhale, bring it in. Exhale. And inhale. 2 more. You should feel that deep connection happening, especially on the one side of the working leg. Good. Bring it in. Let's do the other side. It's going to take a little bit of practice to get those deep abdominals working, but you should feel something in this kind of lower abdominal area. If you put your hands on or fingertips on the inside of your hip bones, you want a gentle drawing away. So you should draw away from those fingertips. You shouldn't feel a bulge. So if you're feeling a bulge, it means that you're bearing down on your pelvic floor a little bit. So we don't want that. Inhale. Set the core. Being conscious of the back of the pelvis, the bony landmarks being nice and evenly placed on the mat. Good work. All right, we're going to move the ball, or just take your feet down. We're going to roll up, so just turn to your side, support yourself, and get yourself up somehow. So in the beginning, this is a great way just to get those deep abdominals working, setting the core, and then starting to make the movement. And then once you've got that, we can start to progress into other exercises. But initially, if you've got back issues or you feel like your core is very, very weak, this is a great way to start. Just be patient. It's slow in the beginning, but you're going to give yourself a really good foundation. Thanks.